nursing care of the family, having difficulty conceiving a child.
Vaginal and cervical concerns. During ovulation, ang cervical mucus natin ay nagiging thin or watery at saka madali ang pagpasok ng spermatozoa. Pero pag hindi nagsabay ang ovulation at saka sex, the cervical mucus ay kakapal siya at mahihirapan si spermatozoa na makapasok sa cervix ng babae. When cervical mucus is in the wet or raw egg white consistency stage, ovulation is approaching. Fertile cervical mucus helps sperm survive and swim in the vagina. The normal vaginal pH is between 3.8 and 4.5, which is moderately acidic. But before menstruation and after menopause, a healthy pH tends to be higher than 4.5. A woman who has undergone dilation and curettage procedure several times or cervical congestion should be elevated in light of the possibility that scar tissue and lightening of the cervical os has occurred. A woman may be prescribed low-dose estrogen therapy. Low-dose estrogen therapy, this is a medical term that describes the skin changes that occur in the vagina, urethra, and vulva. When the ovaries no longer produce estrogen after menopause, this can lead to changes in the acidity of the vagina, leading to the skin becoming dry, thin, sore, and less lubricated. Vaginal infections such as trichomoniasis and monoliasis tend to recur, requiring close supervision and follow-up. Is caused by a parasite that spread really easily during sex. The symptoms of this are irritation and itching in the genital area, white, yellow, or greenish vaginal discharge that has a bad odor. See your healthcare provider if you have any symptoms. Ito ay ginagamit ng babae na may vaginal infections. Pinapatay nito ang bacteria o piniprevent ang paglaki ng bacteria sa vagina ng babae. It also treats certain stomach-like intestinal ulcers caused by bacteria, and therefore should not be continued if the woman is pregnant.
Unexplained subfertility. In a small percentage of couples, no known cause for subfertility can be discovered. It may be that the problem of one partner alone is not significant, but when combined with a small problem in the other partner, together this becomes sufficient to create subfertility. Often, physicians and researchers consider a couple to have infertility if they have not conceived despite regular intercourse without using birth control for at least a year or up to 2 years. 15 to 20% of couples will not conceive despite a year of trying. However, this does not mean that they will not conceive later on, even without treatment. And more than 90% of couples will have achieved a pregnancy within 2 years. It is obviously discouraging for couples to complete a fertility evaluation and be told their inability to conceive cannot be explained. Offer active support to help the couple find alternative solutions at this point, such as continuing to try to conceive, using an assisted reproductive technique, choosing to adopt, or agreeing to a child-free life. In the past, infertility was commonly considered to be solely a female problem. It is now recognized that a couple's infertility is just as likely to stem from problems in the male partner. After couples with infertility undergo testing, about 40% of the cases are found to stem from female factors and another 40% from male factors. In 10% of couples, infertility factors are found in both the man and woman. In the remaining 10%, the infertility remains unexplained after testing. Because either or both may be involved, it is important to test both the man and woman before starting treatment. No matter what the cause, most treatments require the active participation of both partners. Assisted reproductive techniques. If ovulation, Sperm production or sperm motility problems cannot be corrected. Assisted reproductive strategies are the next step for a couple to consider. Before beginning any of these procedures, urge a woman to be in excellent health by discontinuing smoking or recreational drug behaviors, ingesting a diet high in protein, and having BMI within a normal range of 18.5 to 24.9. She probably also will have, if she has not already had them, tests for HIV and hepatitis C, a hormone profile including levels of FSH, LH, estrogen, and progesterone to test for ovarian reserves, whether ovaries have the capacity to produce multiple oocytes, as well as intravaginal sonogram to visualize usual internal structures of the female reproductive system. Whether a woman feels comfortable choosing assisted reproduction is strongly socio-culturally related, as people on a limited budget and without health insurance may not be able to afford these therapies, or their religion or cultural beliefs may make these unacceptable procedures. Nursing care planning to respect cultural diversity. Obtaining a sexual history is often difficult because cultural taboos can make couples feel uncomfortable discussing this part of their life. Simple factors, such as how often couples engage in sexual relations, for example, are influenced by culture and religion. Being aware of cultural differences can help you understand the different ways couples react to a diagnosis of infertility and help you appreciate the full meaning of this diagnosis to an individual couple.
Alternative or intrauterine insemination is the installation of sperm from a masturbatory sample into the female reproductive tract by means of cannula to aid conception at the time of ovulation. The sperm can either be instilled into the cervix, into cervical insemination, or directly into the uterus at the time of predicted ovulation. BBT charting, mucus analysis, or urinary test kits for LH can be used to detect the day of ovulation. Intrauterine insemination may be performed if a woman is having troubles getting pregnant, a condition known as fertility, or it may be done if a woman wants to have a child without a male partner. The menstrual cycle of fertile women usually lasts about a month. During this time, and under the influence of the body's own natural hormones, a tiny sac within the ovary containing an egg grows. A point midway in the cycle, this egg is released from the ovary in ovulation. Of course, ovulation is also regulated by hormones. The egg, which from the moment on it's ready for fertilization, then passes into the uterine tubes to await the arrival of fertile sperm. Ovulation is a naturally occurring event, and the desire to have a children is a similarly natural instinct, but that instinct cannot always be fulfilled. The causes of unwanted childless are numerous, but so are the means of treating them. Donors for alternative insemination ay ang similya ay binibigay ng partner at pinoproseso sa laboratory. Sa IAD, ang similya ay nagmumula sa isang bank na kung saan ito ay na-freeze na hindi bababa sa 6 na buwan. Ang cryopreservation time na ito ng donasyong similya ay kinakailangan upang mapatunayan na ang donor ay walang anumang uri ng infeksyon gaya ng HIV. The clinic itself is responsible for choosing the most sustainable donor based on their physical and immunological characteristics. For this reason, the woman receiving the seminal sample will receive general data from the donor, but at no time will they be identified to guarantee her anonymity. In addition, in order for a man to be a sperm donor, he must meet a series of requirements and pass some medical and psychological tests that show that he is healthy.
In vitro fertilization is a type of assisted reproductive technology, for short ART, where sperm and our egg are fertilized outside of the human body. IVF is a complex process that involves retrieving eggs from ovaries and manually combining them with sperm in a lab for fertilization. Several days after fertilization, The fertilized eggs, now called an embryo, is placed inside a uterus. IVF is an option if you or your partner has blocked or damaged fallopian tubes. Endometriosis is a disease where tissue similar to the lining of the uterus grows outside the uterus. Low sperm count or other sperm impairments, polycystic ovary syndrome or PCOS, or other ovarian conditions. Uterine fibroids are benign tumors in the uterus. Fibroids can interfere with implantations of the fertilized egg. Problems with your uterus, risks or passing on a genetic disease or disorder. Unexplained infertility means no cause of infertility has been found despite evaluation for common cause. This picture shows the procedure of in vitro fertilization. What are the most common side effects of IVF? Side effects during ovarian stimulation. The increase in the hormone estrogen can cause breast tenderness, slight nausea, dizziness, slight abdominal swelling, abdominal pain, swelling at site of injections. The side effects after the ovum retrieval is abdominal pain and discomfort, bloating due to water retention, and side effect after embryo transfer. The hormonal medication given prior to embryo transfer may cause some of the following side effects: constipation, water retention, cramping, breast tenderness, and spotting. Client can select the gender during IVF? Yes. After the egg and sperm have been combined and fertilization has occurred, the fertility doctors can examine the embryos. By conducted through a process called pre-implantation genetic diagnosis, the PGD, or pre-implantation genetic screening, the PGS or PGTA. This is testing on embryos. For fertility doctors can determine if an embryo has any chromosomal abnormalities that could result in a birth defect or developmental issue. In addition to identifying genetic issue and potential birth defect is PGD, PGS, PGTA. Tests can also be used for determine the gender of your child. Fertility doctors identify if an embryo carries two X chromosomes, females, or an X and Y chromosomes is male.
We find gift interchangeable transfer of gametes. It is a technique that consists in taking the oocytes by ultrasound, guided vaginal route, or through laparoscopy. At this point, the female and male gametes are transferred into the fallopian tubes where fertilization should take place in the event that embryos or zygotes are transferred. We speak of zip technique intertubal transfer of the zygotes. The advantage of gamete intrafallopian tube transfer. The fallopian tube acts as the laboratory. The embryo will reach the uterus at a later stage in its development as with normal conception. The endometrium will also be more receptive to the embryo because of the greater time the embryo takes to reach the uterus. Disadvantages of gamete intrafallopian tube. Neither fertilization nor quality of the formed embryo can be assessed in GIFT. GIFT does not recommend a female with a damaged or complete blockage of fallopian tube. The zygote intrafallopian tube procedure. The eggs are harvested as in IVF. They are mixed with the sperm and in this can are fertilized in the laboratory. They are then implanted in the fallopian tubes as is GIFT. Advantage of zygote intrafallopian tube. Doctor and couple are assumed that fertilization has taken place and the egg can be examined for defects before implantation.
Surrogate embryo transfer. It is an assisted reproductive technique for a woman who does not produce ova. Ito ay isang assisted reproductive technique para sa isang babae na hindi nakakaproduce ng ova or egg cell. For the process of oocyte is donated by a friend, relatives, or an anonymous donor. The menstrual cycles of the donor and recipient are synchronized by administration of gonadotropic hormones. For example, in men, these hormones cause the testicles to make testosterone. In women, they cause the ovaries to make estrogen and progesterone. So, these are the steps of surrogate embryo transfer. The first is the ovarian stimulation or yung pagpapasigla ng ovarian. Ovarian stimulation occurs with the administration of hormone medications or ovulation drugs that stimulate the ovaries to produce multiple eggs. So, ang ovarian stimulation daw ay nangyayari sa pagbibigay ng mga gamot sa hormone or yung mga gamot sa ovulation na nagsistimulate sa ovary para makaproduce ng multiple eggs. The second one is the egg retrieval or yung pagkuha ng mga egg. And the third is the fertilization. It gather eggs from the mother or an egg donor, fertilize them with sperm from the father or a sperm donor, and place the embryo into the uterus of a gestational surrogate. The fourth is embryo culture. Embryo culture creates conditions for infertile and infertile people to have a chance to have children from the father's sperm and mother's eggs. In the case of surrogacy, the embryo is placed and developed in the uterus of the surrogate whose child is not genetically related to the surrogate. So, the last one is the embryo transfer. An embryo is transferred to a woman na pumapayag na mag-carry ng pregnancy and mag-deliver ng child.
End of presentation. Thank you for listening.